what is internal medicine? What is geriatry?
Right, they become frank diabetics, frank hypertensives,
What is internal medicine?
helping the body bring it back.
Right. So why medicine?
They suddenly become diabetic.
Post-meal crash also leads to diabetes.
There is increased insulin in your body.
Moving on to the serious topic, autoimmune disease, right? What is it first?
Fight against itself.
What internal medicine is all about? Autoimmune disease, right? What is it first?
Okay. Autoimmune disease is where your body tries to fight against itself. Okay. So that is autoimmune disease. There are certain diseases like SLE, systemic lupus erythematosus, Sjogren's, then you have rheumatoid arthritis. All of these are autoimmune diseases which most people wouldn't even have heard of. Right. So they are slowly kind of increasing. There is increased patients that we are seeing nowadays. Maybe because of they have more awareness that there is such disease. That's why they are coming to the fore. Second thing is also the modern lifestyle, again stress factor. We don't know if there is a direct relation because usually autoimmune gets triggered with genetic susceptibility as well as there is an environmental trigger.
Oh,
okay. Then stress can be one of the what we call epigenetic modification. That is beyond genetics, if there is something that can get modified in your genes. So stress can be one of those things. So that's why we are seeing increasing population, increasing numbers of autoimmune diseases in the population.
okay. So are these autoimmune diseases curable?
Okay, before answering that question, I'll just give you a brief as to why autoimmunity happens. Okay, as you are a kid, there is some organ called as thymus. Okay, which usually kind of involutes as you grow. It's not there, it's no longer there. It kind of sees that, you know, one cell is presented to it. It says that, okay, this is mine, this is not mine. So that thing happens in the childhood only. That all of your cells are presented to it saying, see, this is mine, don't attack it. Okay. So sometimes what happens, there are a certain pool of cells which don't get erased, that the self cells, the thymus will not have recognized that it is mine.
Okay.
So in the future that becomes like self-reactive. Okay. So there are certain cells which have missed this tolerance, the central tolerance which the thymus does, some cells would have missed it. Second thing is there is some organs which never get exposed to the thymus at all, like the eye. Okay. Eye is very much secluded, right? So when there is an eye injury and those cells get exposed to the immunity, the body does not recognize that it is mine. Okay. And there is some concept wherein there is autoreactivity, like when there is an infection, it's like a strep throat. Okay, you have a throat infection. The bacteria that causes strep tonsillitis or something, that is very similar to the heart and the bones, the cartilages basically. So the body, instead of getting rid of the strep throat, kind of attacks the heart as well as the bones.
Oh.
So they have this rheumatoid heart disease in the future. Right.
I mean, can't that be diagnosed before only?
I'm sorry, it's not rheumatoid, it's rheumatic heart disease. There is
repeat that.
So when there is a strep throat and the body tries to get rid of the strep tonsillitis, there is a molecular mimicry happening between the strep and the heart and bones. So they get injured in the process of body trying to get rid of streptococcus. So you have something called as rheumatic heart disease. Okay. So that is where the heart gets affected because the body was trying to get rid of your streptococcus infection. Okay. So these are examples of autoimmunity.
Can't they be identified at a young age itself? Because when you if there is a possibility, I don't know, there are so many tests that is coming up, right, in these days. At the age of 13, 14 and all that, you go and you take all the PCOS has become so common. You take all the blood tests that is necessary also. But isn't there any test that can actually recognize that in future you're going to get an autoimmune disease?
Yeah, in future you're going to get, that's what I said, there is this genetic susceptibility, environmental triggers and then other stress factors and all. So it only gets triggered when all of these three converge, okay, you might have the genetic susceptibility, but you might never have the disease.
Okay.
Okay, so
it's always a question mark only. You never know till it comes.
Yeah. So, like you have patients, their children might never get it.
Okay.
Even though they have the same gene.
Yeah, that's very interesting.
So, even in twin studies also, one twin gets it, the other one doesn't get it, even though it's the exact same copy of genes that they have. So, what is happening in medicine is there's something called next generation sequencing that's happening. Have you heard of it? Next generation
it's very new.
Wherein your DNA is completely analyzed, and whatever future diseases that you might have,
the genealogy, is that what it is?
Next generation sequencing.
Okay,
it's called.
fine.
So basically, whole of your gene is analyzed, and you are going to pick up diseases that you might have in the future, like diabetes, hypertension, and anything. And so you have this idea, okay, I am susceptible to this, and I need to avoid certain things. But then there's a whole lot of ethical consideration when it comes to that. Some people don't want to know.
Yeah, actually, I mean,
like the same
there
thing
is,
when you go to astrologer.
True. When you know you're going to die, why will you want to know when you're going to die and you're going to die because of this? I don't think, I mean, at least I will not want to know the serious diseases, Some chutko-putko small stuff is still okay, which
But
is
then
curable.
see, if somebody picks that you might have a cancer risk, right? You want to know, but your brother or your sister wouldn't want to know that. So what is the legal or ethical implications of doing that? So it's very it's coming. It's going to come up in the next maybe 5 or 10 years. It's called precision medicine.
Okay.
It's slowly the world is going into that. It's too early
too early. Yeah, okay. That's a very interesting subject, right? So yeah, so I mean, is the autoimmune curable? Coming back to the
autoimmune, some people go into remission, right, with the disease modifying agents and lifestyle changes and all. It will go into remission, but then once that they have flare ups when they are stressed. So it's not completely curable. The same thing that you can tell for diabetes, right?
That's all. There is only remission. That's it. Okay. But I mean, it is a very life-threatening disease, right? Autoimmune.
If not, if it is not controlled, if it is not diagnosed,
something like cancer, equivalent to cancer, because your body is killing its own cells, isn't it?
Right. So you treat it in the initial phases, then before the damage happens, then it is not. It is like one of your lifestyle diseases, only you can control it. But most people, because they have this multi-system involvement and symptoms are usually vague, it kind of gets missed. And severe organ damage would have already happened, like lung fibrosis or cardiomyopathy. These things, once that has set in, it's eventually going to, cause rapid decline.
Something next to cancer is what autoimmune is, that everybody is worried about, right? So that's probably one of the buzzing jargon that is going around.
And they don't want to start steroids because they've heard bad things about steroids. So they don't want to start steroids.
Yeah, that's a whole lot of topic that I will come to. Yeah. Okay. So when you say internal medicine, right? Same medicine, different people. And how will people actually react and respond to the same medicine when it comes to internal prescriptions, internal medicine prescriptions? What are your thoughts on that?
Okay, right now we are not kind of individualizing the treatment as such. But then again, as I said, they are doing this genetic analysis and all. So there, why this happens is something because of pharmacogenomics. Okay, why this is happening? That different people react differently to medicine is because there's something called as CYP enzymes in the liver. They have different polymorphisms. So if I have, say, it's called CYP450, right? If I have one variant, you will not have the same variant as me. Okay, but there is something that is predominantly there in the population. The treatment is directed at them. People, there are people who are rapid metabolizers of a medicine. There are some people who are poor metabolizers of the medicine. Then there are people who don't metabolize that medicine at all.
Okay.
So some people have more side effects to the medicine because of the same reason. Some people will not have any effect of the medicine, and some people it works just fine because they are the people who are in the majority of the population. And these medicines are tested on kind of like a majority, and then come to a conclusion ki chalo, for this disease, you have this medicine. So that is why there is variation in how different people respond.
Okay. The next question is gut health, right? Gut health is also something that's buzzing around, right? So what is the connection between gut health and your immune system and internal medicine?
Right. So it's not come to the fore in internal medicine as such, but then there are people that are practicing functional medicine. Right, so it is a buzzword among them.
Yes.
But then where we deal with gut health is mostly with the IBS, irritable bowel syndrome and all. I'll tell you what gut health, why it is linked to immunity. So we have 70% of lymphoid cells. Lymphoid cells are the centers where your immune cells are situated. Okay. Let's just leave it at that. So lymphoid cells are where your immune cells are situated. So 70% of the body's lymphoid organs are there in the intestine. Okay. So these are the ones which will kind of protect you against all the bacterias or filter their toxins out. Okay. That is one thing. Second thing is they also produce certain chemicals like serotonin or dopamine. You have something called GABA. So all of these productions happen there, which is kind of mediated by good bacteria in your gut along with the lymphoid tissue. The brain and the gut communicate through all of these chemicals. Okay. So your mood is influenced by your gut.
Okay.
Yes. So your mood is influenced by which good bacteria you have in your gut, whether your immunity is dependent on that, the harmony of the good bacteria. And also, some people, have you seen some people when they get anxious, they get this gastritis or, they have to go to the loo very frequently. They have this loose motion and all. All of this happens because, you have something called gut dysbiosis. Okay. So you might have heard that this probiotic company is just booming out of nowhere. Because they're kind of factoring in all of these things, and they assure you everything from happy hormones to cure from metabolic syndrome. Yeah, but then it is not one solution that fits all. So it has to be kind of customized to you, and then just don't take things off the rack. Like it shouldn't be OTC. Okay. So yeah, gut health is the boom right now.
Yeah. So gut health also affects the immune system.
Yeah.
It's probably directly related.
It's directly related. That we knew, medicine knew it from long. But this gut-brain axis and how it affects your mood, your immunity,
that's very interesting,
through that and all, it's recent.
So I mean, how does it actually? So are you telling that good food will give you good mood also?
Yes, that Ayurveda has been telling us from centuries that your good food, food that is prepared when the cook has been in a good mood. So all of those things Ayurveda has been telling us, but then we only accept it when it becomes a modern fad, right?
True.
So what internal medicine, modern medicine, allopathy says is, food has to be teamed with good bacteria like probiotics, prebiotics, all of these things you have to include in your diet so that your bacteria which you are born with gets preserved and they are able to have a good two-way communication between your brain and gut. So that is what it would do.
Can you please name a couple of good probiotics that we can actually include in our daily food?
Yeah, see, we have this fermented foods, no? Dosa, idli, all of these are fermented foods. So they have a good source of probiotics and curds. Okay, curds, buttermilk.
Dairy products.
Yeah, fermented foods.
Fermented foods.
Fermented foods have good probiotics.
Okay.
Which our ancestors knew before this came. Right.
So it's like almost our it's coming back. Whatever our ancestors have been telling, it's like
we didn't know the logic, so we didn't accept it then.
Right. Yes.
But then now people are like having proper studies and telling that what your ancestors knew was only right. You please follow it. So it's come to that.
Right. Okay. So what is one blood test result or blood test that is misunderstood by a lot of patients that should be interpreted in a better way?
One blood test. I will tell you a couple. Okay. One is your CBC. CBC is a complete blood count which will tell you about hemoglobin, total counts, total leukocyte counts, platelets. Right. So in that hemoglobin, if it is normal range, doesn't mean it is normal. Okay. So if you are a little bit off the range on the lower side, it is better to get it evaluated before it becomes a problem. Like 10, 11 and all, it's in the normal range, but it can still cause you fatigue. So you can evaluate it rather than thinking, okay, chalo, why spend money when for more tests when it is normal. So that is one thing. Total leukocyte count also, there's something that is normal for you and something which is normal in the range. So if it has gone above normal for you, then there is definitely there's something that's happening in terms of chronic inflammation or allergies. So you can keep a track of how your test reports are, and then maybe consult somebody for the same before, like how I said in hypertension, it will not show up on the test until it becomes bad. Okay. So similar thing for CVC. And another one is TSH also. TSH is your thyroid stimulating hormone. So if it is on the higher level, like the range normally that's given is 4.5. 5, 6 are usually ignored. But what the body is trying to tell you that it's not able to keep it in the normal level. So there is some process which is happening beyond the test reports, which we are not looking at yet. So this can be your explanation for fatigue, hair loss, or dry skin, which don't get looked into.
Okay. So cholesterol also, isn't it? Lot of people, for example, if you take me or anybody, right? If you take cholesterol, there is good cholesterol and bad cholesterol. It is never within the range for the food, for the junk food that we eat outside right now. It's always on the higher end. So how should one actually take that? Should they say that there is a limit, no? After this point, you should definitely have medicines for cholesterol, reduce your oil, your junk, all of that. So what is the value where that person should actually go and consult a doctor when the cholesterol is a little on the higher end also?
See, basically all the studies that have been done are usually for the American and the European population, right? That being said, you cannot completely ignore them, but then usually you have to keep your triglyceride and high density lipoprotein. The ratio has to be right, okay? Rather than the absolute value as such, the ratio you have to take TGC versus HDL. And second thing is LDL is also a bad cholesterol, that has to be within 100. TGC has to be within 150. HDL in females, males it varies, again 40 to 60 is what we target. So rather than the absolute values, we have to see that the balance between the good cholesterol and the bad cholesterol is maintained.
Okay, got
Second thing is, once it goes beyond a certain limit, like 150 is the cutoff for TGC, right? Triglycerides. If it's like 300 and all, you cannot still say that I will control it by diet. So it causes pancreatitis. So that is when you have to step in and take medical help. Okay.
So does it have a direct connection with your heart disease as well?
Yes, because they cause something called as atheromas, the rust that I was talking to you in the blood vessels. So that is where they come in,
So they are also one of the major cause for heart blocks and
there's a lot of back and forth happening because of that, rather than, keeping it organ based, you have to see the whole body what is happening. Right, so there are different factors that influence it. You have to keep everything in balance.
So can we actually tell in a precise statement that if your cholesterol is high, definitely it is linked to your heart diseases, that is actually in the rise of all of this angiograms and angioplasties have become just a visit and come back, right? So and it is actually increasing a lot also these days. So can we again go back to and say that it's all because of the food that we eat, right? So that's the base, underlying base. So you eat cheese and your salty chips like day in and day out, so you will result there only. So that's kind of a cycle.
Yeah, that is kind of a cycle. So cholesterol alone cannot be the culprit, right? So one thing is cholesterol, and along with that you have to have your sugars under control, your hypertension,
multiple other factors.
Not just cholesterol, you have to see the person holistically.
Okay. So Google doctors are in the rise. So when do you think that a person should really come and meet you? Because they have the solution by themselves. If a person has to come and see an internist or a general physician, when is it that they have to come? See, for fever, we know if it is more than 101, Dolo is not going to work. So, are there pointers where it is high time you say that, you better come and consult a doctor instead of just Googling it yourself?
I would always say that rather than Googling, you come to the doctor only first. But then if you have somehow kind of been able to tide over, then that's good for you. But if your fever is persistent in spite of taking medicine, if you're having symptoms like vomiting, headache, so these are kind of red flag signs in fever, right? So you approach a doctor in fever, that is. In your lifestyle things, if you're having like unexplained fatigue, okay, there's nothing that explains why you're feeling like that. And then there are constitutional symptoms. Constitutional symptoms in the sense you're having weight loss or weight gain. Then fever with night sweats. Okay, so then you have to come to a doctor at the earliest. Multiple system involvement. Multiple system involvement in the sense you have loose motion also, you have cough also. Then don't trust Google completely because like I always tell my patients, Google, you treat it as a buffet. Okay, so what all you have to eat from that to make a healthy plate, you have to consult a doctor.
That's amazing. So, I mean, I think internal medicine, general physician. So, we've got a gist of what has to be done, what should not be done, and all that, right? So, that was an amazing 30-minute or whatever the conversation or to enlighten our audience about what internal medicine is all about. Okay, so to wrap up internal medicine talks, right? So, if you have to give an advice to the Gen Z out there or Gen Alpha Beta, what are the two things that you really want to tell them?
Yeah. So basically, whatever complaints that you have, and if you're trying to seek treatment in modern medicine, you have to first go to a physician. Okay, because that is where they will be able to tell ki which system your illness falls under, whether that can be sorted out here or it needs referral to a super specialty. Rather than you approaching the super specialist first and then finding out that that was not where your problem was, treat a physician as a central point wherein all your problems can be solved or at least directed to, right? Second thing is the chronic diseases are on the rise. It's not something that only your Ajjaji used to have or your parents that are getting older will have, but it is approaching a point wherein even you can have it. So high time that you get your things in order and prevent this from happening.
Okay.